Hi guys, welcome back to my channel. My name is Miss Oma. I'm a 40 medical student in Nigeria. This video I'll be sharing some tips I use during my pre-clinicals. The information in this video is just from my own personal experience. First one is studying with past questions, because past questions is going to expose you to what questions the lecturers like asking. It's going to help you know the topics you're going to focus on, because you actually have a lot of topics to read, so you have to narrow down your reading, and past questions are going to be of good help. Next tip is that you should ask questions. It's not advisable to be ignorant during your pre-clinicals. You have to ask questions, get information from your senior colleague about a particular lecturer, his way of asking questions, his preferences when you answer questions is really going to help you during your exams and your tests. The next tip is that attend your lectures. Attending your lectures and knowing what the lecturer is teaching and knowing how the lecturer expects you to answer his or her own question is actually going to help you a lot during your pre-clinic. The next tip is that you should read consistently. You need to be consistent in your reading. You don't have to read once a week. Next tip is ahead in quotes. I actually got this from a senior colleague. Pre-clinicals is ahead. You already failed a test or an exam. You don't need to keep thinking about it. There is nothing on earth that is going to make time to go back. So the best thing you can do for yourself is to keep going. Next tip is that you should use the textbook that is best for you. Don't use a textbook because some majority of your colleagues are using that particular text, or it was recommended by the lecturer, or it was recommended by a senior colleague. The best textbook that you should use is the textbook that actually works for you. The next one is that you should learn to adjust. Don't be so fixed on a particular plan when you are seeing that the plans are not working for you. If this plan is not working to you, try another plan. The next is that you should know your distractions. Movies, social media, friends. Just know your distractions. Not just knowing them, you need to also know how and learn how to curtail these your distractions so that they won't get in your way of reading. That brings me to the next tip, which is time management. You should know how to manage your time very well. A lot of medical students are into entrepreneurship, politics, and different hobbies, and they actually do this and still pass, not because they have two heads, but just because they know how to manage their time effectively. Next is that you should set goals. Goals are very important. Set short-term goals and long-term goals. Short-term goals can be daily goals. Okay, I'm going to cover this topic today. Then long-term goals are goals that you want to achieve, maybe a particular course, you want a particular score. Just set your goals and actually work towards them. The next one is that you should give pre-clinicals your best. Don't slack off. Don't be a lazy medical student. It's a nonchalant medical student that doesn't care about anything. You don't care whether you're writing tests tomorrow. You don't even care. Just don't be like that. Focus and give it your best. Last tip is that you should pray. Pray. From my own view, I feel like medical school is not just about hard work. Hard work is part of it, but it's majorly grace. You need to pray for grace, pray for mercy. Just pray to God. Always pray. Doing your pre-clinicals, always pray. So we've come to the end of this video. Thanks for watching. Don't forget to like, share, and subscribe.